Assalamualaikum and good day to everyone. For today's presentation, my group, which is group 9, will present about case study 1. Firstly, I will discuss about the MNT of in type 2 diabetes, which is Mr. Siva is daily diagnosed with type 2 diabetes mellitus and he is under medication of metformin to control the blood glucose. Firstly, the goals of the MNT in type 2 diabetes mellitus is to have normal or as near as possible glucose, lipids and blood pressure. Next is to prevent or slow down the rate of development of chronic complications. And furthermore, the MNT is used to address individual nutrition needs such as cultural preference and willingness to change. Lastly, MNT is to maintain pleasure of eating by only limiting food choices when indicated by scientific evidence. This is the MNT for Mr. Siva. Mr. Siva need to monitor the carbohydrate intake. Firstly, Mr. Siva need a minimum of at least 130 grams per day of carbohydrate. The balanced diet consisting of 45 to 60% energy from carbohydrate. Next, Mr. Siva needs to eat whole grain cereals for at least 20 grams to 30 grams per day. And the intake of the whole grain should form 50% of the total whole grain intake. For one serving of wheat with carbohydrate is equal to 50 grams of carbohydrate. Mr. Siva also needs to substitute high GI foods with lower GI food with adequate GL, such as substitute white rice to brown rice. Next, Mr. Siva also need to reduce weight as reduce weight loss to 7% to 10% of initial body weight within 6 months because Mr. Siva BMI is 26.9, which is fall under category overweight. Next, for the protein intake, Mr. Siva does not have renal problems, so he needs to take 15 to 20% of energy, which has minimal effect on glycemic control. Mr. Siva also can eat lean sources of protein such as fish, chicken, poultry without skin and soy protein. However, Mr. Siva needs to limit the consumption of the sweetened beverages to less than 2 servings a day. He also need to limit the total fat, saturated fat, trans fat and dietary cholesterol. Other than that, he also need to limit the sodium intake as his blood pressure is under elevated blood pressure. For the physical activity, Mr. Siva can do 150 minutes per week of moderate intensity such as fast walking or 90 minutes per week of vigorous aerobic, and he need 2 sessions per week of resistance exercise. For behavioral, he need to stop smoking as high content of nicotine will reduce the effectiveness of insulin and also to prevent chronic complications such as heart disease. In doing physical activity, Siva needs to take some caution as to prevent hypoglycemia. He needs to check his blood glucose level before and after the exercise. If pre-exercise glucose level are 5.5 millimole per liter, he needs to eat foods that contain carbohydrate. And also, he needs to add 50 grams of carbohydrate for every 30 to 60 minutes of moderate physical activity. Next, I will pass to the next presenter.
Okay, next is how to explain or educate on carbohydrate counting. So firstly, we need to explain on what is carbohydrate counting to the patient. Carbohydrate counting is a meal planning method for regulating blood glucose levels in diabetic individuals. These techniques assist you in determining the quantity of sugar and starch in the foods that the patient eat, allowing the patient to distribute carbohydrates throughout the day and avoid high blood sugar after meals. So we need also to explain to the patient about the carbohydrate and its sources. The carbohydrates are the primary source of energy in the body. There are 2 types of carbohydrates, which are simple and complex carbohydrate. Examples of complex carbohydrate are such as rice, bread, and potato, while examples of simple carbohydrate are such as sugar, syrup, and cordial. Next, these are the carbohydrate recommendations for the diabetic patient. The total carbohydrate intake can be measured using grams, exchange lists, household or hand measurements, as long as they are easy to understand and follow. A minimum of 130 grams of carbohydrate per day should be maintained to ensure adequate fiber, vitamin, and minerals intakes, and thus to prevent ketosis and provide nutritional palatability. A total carbohydrate content of 45 to 60% of total energy is advised. The evidence proportion in diet or meal plan on glycemic management is inconclusive as it depends on various factors such as weight, glycemic, and other metabolic goals, cultural preferences, and individual lifestyle. Next, this is the way to do the carbohydrate counting, such as check food labels for serving size and carbohydrate grams, refer to carbohydrate counting list, or refer to the nutritional information in restaurants or and on website, or use online carbohydrate counting resources and food composition books. This is the figure 1 shows the exchange of 4 sugars and local kueh. For example, white sugar for one exchange is 3 teaspoons, which is 15 gram. One carbohydrate exchange is equal to 50 gram, and 1 teaspoon is equal to 5 gram, while 1 tablespoon equals to 10 gram. Any other types of sugar, such as honey, brown sugar, cane sugar, gula melaka, should also be substituted for carbohydrate exchange. Next, this is figure 2 shows the carbohydrate content of common Malaysian foods such as cooked rice and roti canai, and figure 3 shows the food groups and exchange lists for cereals, grain products, and other starchy vegetables. For example, for half cup of rice is equals to 1 exchange, which is 15 grams. Next, this is the exchange group for fruits. For example, one exchange of orange is 1 medium. The recommended intakes of fruits for adults is 2 to 3 servings daily. One serving of any fruit, regardless of sweetness, should include around 15 gram carbs, and the effect on blood sugar is roughly the same. Next, and this is the food groups for exchange for milk, which is there are different carbohydrate in one exchange for skim, low fat, and full cream. For skim is 15 gram per one exchange, for low fat 12 gram per exchange, and for full cream is 10 gram per exchange. Next, this figure shows the example of food composition tables for different meals from Atlas of Food Exchanges and portion sizes. For example, here it is for nasi goreng, the carbohydrate content is 53 gram for one plate. Next, this is the examples of household measurement that the patient can use to portion the food. Next, and this is the patient's diet history on carbohydrate intakes in a day. So this is the list of carbohydrate based on breakfast, morning snack, and lunch and dinner. So for the total carbohydrates that the patient have consumed is 326 grams. Based on the amounts of carbohydrates consumed by patients, it is advised that proper portions of food intake should be planned and followed based on recommended energy intakes. So next is the next presenter.
Okay, I will continue for the nutrition care process. We use a process which is for assessment. We have anthropometry. Siva weight is 76 kilogram and height is 168 cm. For BMI is 26.93 kilogram per meter square, which falls in overweight category. For biochemical, has high plasma glucose, which is 99.1 millimole per liter, because the normal FBS is less than 5.6 millimole per liter, and has high HbA1c level, which is 50.5%, since the normal HbA1c value is between 4% to 5.0%. The normal blood pressure is less than 120/80 mmHg. For the clinical, newly diagnosed with type 2 diabetes mellitus has symptoms of polyuria and polydipsia, and has bad lifestyle, which is smoking 20 cigarettes per day. And he take the metformin 500 milligram bit for dietary, has intake of refined sugar, and eat 3 prepared meals per day with snack. Next. For dietary assessment, um, has excessive of sugar intake, nutrition application as evidenced by high HbA1c and has high plasma glucose level related to type 2 diabetes mellitus evidence by symptoms of polyuria and polydipsia, and excessive sodium intake related to frequency use of foods as evidence and level. WHO and fat related to eat restaurant foods as evidenced by diet history and high blood glucose.
Next is the intervention. SEVA will be provided with nutrition education of healthy diet on glycemic index, GI, carbohydrate intake, and also weight management guidelines. SEVA also will be implemented with survival skills on low sodium diet along with low sugar diet principles and a 10 healthy diet program. Advices on reducing high refined sugar intake such as the ice and Milo drinks by consuming plain water regularly and consume less refined and unprocessed foods will be provided. Siva also will be advised to adjust his meal plan and consume adequate nutrient intake according to his recommendation calorie intake at regular and consistent timing along with his medication. Silva also will be advised to perform moderate intensity aerobic physical activity or exercises regularly and lose weight to improve blood glucose control. Next. Next is monitoring and evaluation. Silva will do self-monitor on his own weight daily to keep log. He will also bring his 3 days diet record to clinic for review by dietitian, and he will be having monthly body checkup to monitor and evaluate his BMI status, HbA1c level, and plasma glucose level. Urine output will be measured to monitor the symptoms of polyuria and polydipsia. If there is no improvement in Siva's nutrition status and BMI, reassessment and new goals need to be made accordingly to develop new interventions plan. Okay, next presenter.
Okay, next we go to the meal plan. For energy requirement, we are using quick method. So for physical activity, he is a lorry driver, so we consider it as moderately active. So we choose 25. So the weight times with the physical activity, 25 is equal to 1,900 kilocalorie. So it will be divided into carbohydrate, protein, and fat. For carbohydrate, we use 55%. For protein is 20%, and for fat is 25%. So the weight of macronutrient for each macronutrient is for carbohydrate is 261.3 gram. For protein is 95 gram. For fat is 52.7 gram. Next. For food distribution table, for milk, fruit, legumes, cereal, vegetable, meat, and poultry, fish, fat. For milk, we use 2 exchange, which is contain 180 kilocalorie. And for fruits, we use 3 exchange according to the recommendation of RNI for 2 serving of fruits and vegetables. So it also contribute to 180 kilocalorie. For cereal and for legumes, 2 exchange with 440 calorie, and for cereal 580 calorie, which is among the biggest calorie among the items. Next is we go to vegetable with 5 exchange, and meat and poultry 2 exchange 260 calorie, and fish 1 exchange equal to 70 calorie. Fat 3 exchange which is 135 calorie. So the total calorie will be 1,845. Next. So this is the meal planning for table 4, exchange table of menu planning. So for milk, we will use 2 exchange. It will be assigned for breakfast, and for supper, for fruits, will be 3 exchange for meat snack and lunch, and for dinner. For legumes, 2 exchange for meat snack and afternoon snack. For cereals, for exchange, use for breakfast, 1 exchange for breakfast, 2 exchange for lunch, and 2 exchange for dinner. So for vegetable, 1 for breakfast, 2 for lunch, and 2 for dinner. And for meat and poultry, we use 2 exchange, 1 for breakfast and 1 for dinner. And fish, only 1 exchange, it is for lunch. And for fat, which is 3 exchange, is for breakfast, lunch, and dinner. Okay, next.
Okay, so this is the suggested
300.
meal. So this is the suggested meal for Mr. Siva. For breakfast, he should consume 1 glass of low-fat milk, 1 slice of wholemeal bread, half cup of salad, 2 eggs scrambled, 1 teaspoon butter, which is unsalted. And for morning snack, 1 banana, 1 medium banana, 10 pieces of peanut, and 1 glass of plain water. Next, for lunch, he should consume half cup of brown rice, 1 medium of ikan kembung kari, 2 scoop, which is 120 gram of stir-fried kangkong, 1 slice of watermelon, and 1 glass of plain water. While for afternoon snack, 1 piece of putu mayam, 1.5 glass of unsweetened soya bean milk. Next, for dinner, half cup of fried kway teow plus half cup of sawi, 1 piece of chicken, 1 piece of drumstick chicken, 1 medium mandarin orange, and 1 glass of plain water. And for supper is only 1 cup of yogurt. Next. So for healthy eating, Mr. Siva should choose healthier carbohydrates, such as whole grain like brown rice, buckwheat, oats, fruits and vegetables. And he should also eat more fruits and vegetables, as this could provide the vitamins, minerals and fiber for the body needs every day to keep healthy. Next, he should choose the healthier fats, because healthier fats are in food like unsalted nuts, seeds, avocados, oily fish, olive oil, rapeseed oil, and sunflower oil. He should also cut down added sugar by swapping the sugary drinks, energy drinks, and fruit juices with water. Plain milk or tea and coffee without sugar can be a good start. Next. Lastly, you should get the minerals and vitamins from food, because a patient with diabetes have the same vitamins and mineral requirements as general population. Next. For cooking tips, use non-stick cooking spray instead of oil, shortening or butter. Choose olive, avocado, corn, peanut, sunflower vegetables or flaxseed oil. Season food like meats and steamed vegetable with herbs and spices instead of salt, butter, or sugary sauces. Use low or no sugar jam instead of butter or margarine on bread. Increase the intake of omega-3 fatty acid. Next. Eat whole grain, high fiber cereals or oatmeal with skim or 1% milk. Use low fat or fat free dairy product like milk, yogurt, cottage cheese, and sour cream in place of full fat version. Drink 100% fruit juice that has added sugar. Trim excess fat of meat and eat chicken or turkey without skin. Always buy lean cuts of meat and choose a healthy cooking method like broiling, roasting, stir frying, or grilling. And lastly, buy whole grain breads and cereal instead of ones made with processed refined grains like with flour. That's all.
That's all from Good Night. Thank you.